So in a clinical environment, you would test both sides. However, for the sake of this video, I'm only doing one side. So I've run through consent and what I'm going to do, which is active, passive, and restricted ranges of motion. As you can see here, she's doing active hip flexion, where she's bringing her leg up. And now I'm passively doing it where she's relaxed, and I'm doing it to the full range of motion where she feels comfortable and if she's in any pain or anything like that. So I'm now going to resist the movement. She's going to try and get her knee to her chest, whereas I'm pulling it back. This is isotonic movement, where she's going through the range of motion rather than staying still. So now we're going to go into adduction. So I hold the leg up for her, and she does actively moves it herself. I'm now going to passively move adduction, and then I'm now going to resist it by hooking her leg onto the side. I'm going to hold on to the leg and resist the movement outwards. Here she's restricted. I'm now going to move on to abduction. So she's going to try and bring her leg outwards as much as she can. So this is active. Again, asking for any pain or anything like that. I'm now going to passively do this motion. Again, not taking it too far, just to the point of resistance. I'm now going to restrict this movement isotonically. Next, we have internal and external rotation of the hip. So she's firstly going to, well, after I finish explaining, she's going to internally rotate the hip. So that was actively, and she's now actively externally rotating the hip. So now I'm passively internally rotating the hip and passively externally rotating the hip. I'm now going to resist these movements. I'm looking for any pain or any discomfort she may be having, or any changes in the ranges of motion. You always got to talk to the client to see how they are, if they're in any pain or anything like that. I'm now going to get her to turn around so I can do extension of the hip. So I'm going to support the joint with my hand, and then she's going to actively lift her leg as high as she can, keeping both her hips on the floor. I'm now going to passively do it, making sure there's no pain. And I'm going to resist that movement, checking for pain or uncomfortable or restricted range of motion.